We're now going to start discussing the effectiveness of some dietary supplements and or ergogenic aids. So first of all, I'd like to explain what a ergogenic aid is. So if we break the word apart, ergogenic aid, ergo meaning work, genic producing, aid assisting. So something that helps produce work. So if we actually look at the definition of a dietary supplement or that acts as an ergogenic aid, it could be defined like this: a physical, mechanical, nutritional, psychological, or pharmacological substance or other treatment that either directly improves physiological variables associated with exercise performance or removes the subjective restraints which may limit physiological capacity. So my reason for giving you that long-winded definition is so you can see that when you talk about ergogenic aids, it could be a variety of things. It could be physical, mechanical, nutritional is what we're going to focus on, psychological, or even a drug. And we'll talk about some drugs as we go through this also. So many things can be considered ergogenic aids, but for the focus of our discussion, we're going to talk on things that can be taken into the body either as a nutritional supplement or as a drug that could potentially improve exercise performance. So we're going to start with vitamin and mineral supplementation. So for the most part, as we said earlier, vitamins and minerals are necessary for healthy metabolism, and they're important in metabolic reactions, and so they're definitely important during exercise. So for the most part, if the RDA is met, so the recommended amount for each of these vitamins and minerals, then more does not necessarily appear to be better. There's one kind of exception to this, and that's what we're going to talk about. Some of these vitamins and minerals act as antioxidants. So an antioxidant is a substance that neutralizes a free radical. So a free radical is formed usually from oxidative metabolism, but basically what it is an atom with an unpaired electron. And these atoms with unpaired electrons go around damaging tissues and cells. So they tend to target like cell membranes. They can target DNA also. So these free radicals are kind of bad things to have too much of in the body. So in response to that, your body can make antioxidants to fight off and neutralize these free radicals. So the role of vitamins and minerals comes in because vitamins and minerals can act as free radicals, act as antioxidants. So the thought is, do you need more? Is it worthy to supplement with these vitamins and minerals that act as antioxidants in order to improve your metabolism, to prevent some of the damage that these free radicals are doing? So as I said, the free radicals are produced via aerobic metabolism, and they cause a lot of damage. Sometimes they're referred to as reactive oxygen species. So if you look at this picture, you'll get an idea of what I'm talking about. Here's a free radical being formed. So it's losing an electron, so now it has an unpaired electron, and it's going around causing all this damage to cells. And so an antioxidant can come along and give it another electron and basically get it to calm down and stop doing all this damage. So an antioxidant neutralizes the free radical. So since these free radicals are formed via aerobic metabolism, you would think that if you do a lot of aerobic exercise, you're going to have more free radicals. And that is correct. And so that kind of begs the question, well, if you're doing a lot of aerobic exercise, do you need to supplement with vitamins and minerals that act as antioxidants? And so it's kind of an unanswered question right now. There is some evidence that it might be helpful, but it's not completely conclusive. So because one of the reasons is if you're doing lots of aerobic exercise, your body naturally produces more of these antioxidants. So that may be enough to offset these free radicals, but supplementation may help. And that's kind of the unanswered question, at least as I see it. So exercise, as we said, results in the production of free radicals. In response to that, the body naturally produces more antioxidants, and we call those endogenous because they're produced within the body. And so there is a little bit of evidence that supplementation with antioxidants may reduce some of this tissue damage following intense exercise training. So as far as performance goes, not really any conclusive evidence there. But as far as just reducing the tissue damage, supplementation with these antioxidants may actually help a little bit. But I would say that it's not completely conclusive, because your body does respond well and does help offset this. So as far as another factor to consider, it also depends on the diet of the individual. So if you're getting enough of these antioxidants in the normal diet, then it's less likely that supplementation with these would be that helpful. So some of the common antioxidants are vitamin C, E, and A, and then the minerals selenium and zinc. So other supplements we're going to focus on now. So one of the more popular supplements out there is creatine monohydrate. And I think you know where it fits in. So creatine phosphate is used in the immediate pathway. And it's useful in high intensity activities that last a very short period of time. So the rationale for supplementing with creatine monohydrate would be to put more creatine in the muscle. A lot of this creatine is stored in the muscle. So supplementation theoretically could increase the amounts of creatine in the muscle and thus allow you to use the immediate pathway for a improved period of time or a longer period of time. So creatine is also available in the diet, lots of it in meat, lots of it in fish. Your body makes it. Like we said, the kidneys and liver produce a fair amount of creatine. So as far as how much, the endogenous production by the liver and kidneys is going to be about 1 gram of creatine per day. As far as the normal diet, an average diet, somebody on an average diet would get about 1 gram per day. If we compare that to what's recommended for supplementation, you can see that it's significantly higher. So 20 to 25 grams during a loading phase, or maintenance 5 grams a day. So what's recommended as far as supplementing with creatine does exceed what you would normally get in the diet. And so the question is, does it work? Is it effective to supplement with this? And the answer is yes. This is one of the only over-the-counter supplements that has significant research on it, that it actually does improve exercise performance. So we have to take that for what it is, though. So it's going to improve exercise performance in events or activities that rely heavily on the immediate pathway, since that's where it's utilized. So a meta-analysis that was done several years ago on creatine research, it basically found that there were significant improvements in lean body mass and muscular strength with creatine supplementation. So with these values, so it doesn't look like a lot, but when you think about this as a percentage per week, it's pretty significant. So one other aspect of creatine research is that some people respond to it well, some people don't. So you often get what are called non-responders, and I think a lot of the non-responders are likely those who have a diet that's already high in creatine. And so if you were eating a lot of meats, a lot of fish, and you had a lot of creatine in the diet, it's possible that this supplementation won't give you that much more. So there's an upper limit that your body can handle of creatine. And then once your muscle levels are taxed out with it, you can take in more in the diet, but it's not really going to be stored in the muscle. So the prohormones androstenedione and androstenediol actually too, and DHEA. So these are all prohormones that can be converted to testosterone. So these are sold over the counter. I think now there may be some more regulation on androstenedione and androstenediol. Like I think you may have to be at least 18 years old to purchase it. Nevertheless, the rationale for supplementing with it is that they are precursors to testosterone. And so the thought is, if you put these prohormones in your body, they can be converted to testosterone, which theoretically would be the next best thing as anabolic steroids, and increase protein synthesis and increase muscle mass. So we have this naturally in the body. It's just the thought is supplementation would elevate the levels. And so it's marketed to improve muscle mass and strength, like we said, but there's really no evidence to support that it works. So even though it's a nice idea that you could put the excess amounts of these prohormones in the body and be converted to testosterone, it doesn't really work that way. So it has shown to have some negative effects also. So reducing your HDLs, which would be a negative thing regarding cardiovascular risk, and also increasing estrogen in males, which you can see how that would fit into if you put a lot of these androstenedione diol and diones molecules in the body. Not only could they be converted to testosterone, but they could also be converted to estrogen. So growth hormone would be considered a drug. We have this, it's a hormone naturally found in the human body, released from the anterior pituitary gland, and as you learned earlier, stimulates the liver to release insulin-like growth factors, and the insulin-like growth factors go around stimulating growth in the body. As an ergogenic aid, it is purported to increase lean body mass and muscle strength. And so that would be, the thought is, by injecting growth hormone into the body, it stimulates the liver to produce these IGFs, which go around stimulating growth, and that would include growth of muscle mass. So as far as results, as far as muscular strength, it's not that clear if it significantly increases muscular strength or not. Same with performance, actually. But what is conclusive is that it does improve lean body mass. And that's one of the only things that's consistently shown with growth hormone supplementation. So no conclusive effects on performance, may help with recovery. You hear a lot of professional athletes being caught taking growth hormone because on some level, at least they believe that it's helping them. So lots of side effects. Too much growth hormone can lead to acromegaly in adults, which is abnormal, includes abnormal bone growth, especially in the facial bones and maybe in the wrist also, which could lead to carpal tunnel. And it could affect your glucose control. And because we know growth hormone also plays a role in regulating blood glucose. So, and this is definitely outlawed by athletic governing bodies, and it's illegal without a prescription. So I just wanted to show you this is from a review of a few studies that looked at growth hormone and some of these variables. So if we look at body comp, you see significant improvements. So increases in lean body mass, decreases in fat mass. As far as changes in strength, 1RM in the biceps and quadriceps, it actually went down. So that's not what you would think would happen if somebody was taking growth hormone to improve strength, but it actually went down. And then basal metabolic rate went up a little bit, and that likely is leading to some of the fat loss. So carnitine is another supplement that's sold over the counter. Earlier in the semester, we learned that carnitine is a molecule that helps transport fatty acids into the mitochondria, so it's used in fat metabolism. This is commonly marketed as a weight loss supplement because of its role in fat metabolism. And the thought would be that if you put more carnitine, you're better able to utilize fat and use fat as a fuel, which could lead to potential weight loss or even improve endurance exercise. So research does not support these claims. The only real positive data that's consistent with carnitine supplementation are in individuals who are deficient in carnitine. So if you're deficient, if you have some condition where you're deficient in carnitine, then supplementation definitely could help. But if you have normal levels, more is not necessarily going to help. Chromium is not marketed near as much as it used to be, but commonly sold as chromium picolinate, thought to play a role in insulin and helping improve insulin sensitivity. And by doing that, it could help with weight loss and kind of reduce some of the storage effects of insulin. And there's really no evidence that it works in doing that. So general consensus is that it is not effective as a weight loss supplement, at least in humans. In some of the rat research, they have shown some positive results, but in humans, they've never really shown anything that would show that chromium is effective as a weight loss supplement. As far as caffeine, caffeine is an interesting substance. So we all have caffeine at some point. Stimulates the central nervous system, stimulates lipolysis, catecholamine secretion. We could even say glycogenolysis. So basically, it's going to increase our metabolism. So it has a half-life of about 4 to 6 hours. It has been marketed both as a weight loss supplement and to help exercise performance. So as far as weight loss goes, if the caffeine can actually increase your metabolism, your metabolic rate, it definitely could be effective as a weight loss supplement. one of the issues is that it takes a significant amount to get to that level, and to a level that's high enough to actually have a consistent weight loss. And then you can also adapt to it. So if you're a coffee drinker, you may know that if you have a cup of coffee every day, then you kind of lose the effect over time. So you can adapt to it somewhat. As far as endurance performance, there is some evidence that it can improve performance in endurance and power events. So there's still a lot of research going on caffeine, and a lot of it is positive, but there still are research studies that show that it doesn't really play a significant role in performance. Some of this could even be psychological, but I would say the verdict right now is kind of mixed on whether or not it can significantly improve exercise performance, but it definitely can increase your metabolism. Definitely it's regulated by athletic governing bodies. They've recently changed some of it. They kind of regulate this and monitor caffeine intake, but the levels that would get somebody at least classically banned from an athletic event, the caffeine levels would have to really, really be high. They would have to be ingesting caffeine pills to get to a level that high. As far as ephedrine is a similar concept to caffeine, but it's more powerful. So it mimics the hormones epinephrine and norepinephrine. So since it mimics those hormones, basically it's mimicking your sympathetic nervous system. So it's going to increase metabolism, increase lipolysis, and thus it increases metabolism. So it could be effective as a weight loss supplement. Years ago, they were doing a lot of research on weight loss and ephedrine. As far as exercise performance, it has been shown somewhat to improve performance in some events, some power, some endurance events. However, it has numerous side effects, and even some deaths have been attributed to ephedrine. So it oftentimes can lead to abnormal heart rhythms, and that could play a role and lead to a eventual fatality. So it is heavily regulated by athletic governing bodies, and you can't buy it over the counter. So what you can get over the counter is pseudoephedrine, which is found in some medications such as Sudafed. If you ever go to the drugstore and buy Sudafed, they're going to ask for your ID, so you need to be a certain age. And also, they want to kind of regulate who's buying certain amounts of it, because it could eventually be converted into methamphetamines, and that's why it's so closely regulated. As far as blood doping is a general term that describes any method to increase your red blood cell mass, and the idea would be to increase red blood cells and increase your oxygen carrying capacity, and thus you could improve your aerobic exercise performance. So you could do this via transfusion or drug. So with transfusion, it could be autologous or homologous. Autologous would mean you take out your own blood, freeze it, put it away for a while, then re-inject it just before you're going to compete in an event, and thus increasing your hemoglobin level to a significant amount, and then your oxygen carrying capacity is elevated. Homologous would be someone else's blood is transfused into you, but the concept's the same. Blood is infused, so that's going to really elevate the hemoglobin level and red blood cell count just before some type of competition, and thus improve oxygen carrying capacity. Definitely increases the oxygen carrying capacity, definitely increases VO2 max and performance. So this works really well for improving endurance performance. So the way to do this via drugs would be erythropoietin, which is a hormone that's naturally produced by the kidneys that stimulates the formation of your red blood cells. So taking EPO as a drug will just increase red blood cell amount. And by doing so, you're going to increase the oxygen carrying capacity of the blood, and thus also improve VO2 max and endurance performance. So both the classic blood doping with the transfusion and drugs such as erythropoietin are very effective at increasing red blood cell count and improving exercise performance. Thus, they are highly illegal in any type of athletic event. They screen for this or look out for this in the Olympics, so it's heavily regulated and frowned upon. And if you could be banned from a given event if caught doing this. And I'd like to show you this kind of just description of how it's done. And for exam purposes, you really don't need to know this information, but it's kind of FYI. Comparing EPO to the transfusion. As far as anabolic steroids, so anabolic steroids you hear a lot about on the news. So like we mentioned earlier, family of hormones that are very similar to testosterone, and they can be injected into the body. So why are they so in demand? Well, they increase protein synthesis just like testosterone does. Also testosterone, remember, gives males secondary sex characteristics like deeper voice, facial hair, etc. So there is conclusive evidence that anabolic steroids can significantly increase muscle mass and muscle strength. And that's why a lot of professional athletes and collegiate athletes and others oftentimes will play around with anabolic steroids and see what kind of results they can get. So they're illegal and outlawed in athletics. So one way it's tested, just again, something that's kind of interesting, you can look at the ratio of testosterone to epitestosterone. So epitestosterone is just another hormone similar to testosterone, but no effect on protein synthesis. So you should have a kind of even 1-to-1 ratio of these hormones. And if you don't, and your testosterone level is significantly higher than your epitestosterone level, then that's evidence that you may be taking anabolic steroids, or in other words, your ratio should never be that high naturally. So it tells you that you put something in your body that should not probably be there. So even though they're very effective and work really well, lots of side effects, and I put a list here that's not an all-inclusive list, but some of the major side effects: liver damage, cancers, heart problems, cholesterol issues, testicular shrinkage, prostate gland issues, sperm count reduced, other hormonal problems. So there's a lot of negative side effects that go along with these anabolic steroids.